The day after South Africa suspended a rollout of Johnson & Johnson vaccines, and the country's health minister, Zweli Mkhize, has criticised the terms under which they were bought as onerous. On Tuesday, Mkhize announced that the government had paused J&J immunisations, citing a recommendation by US federal health agencies because of rare cases of blood clots.
Based on their advice, we have determined to voluntarily suspend our rollout until the causal relationship between the development of clots and the Johnson & Johnson vaccine is sufficiently interrogated.
On Wednesday, Mkhize said South Africa's down payments to Johnson & Johnson and Pfizer are not refundable under any circumstances, a consequence he attributed to difficult and sometimes unreasonable demands from vaccine manufacturers. South Africa had been put in the precarious position, he said, of having to choose between saving our citizens' lives and risking putting the country's assets into private companies' hands. The government is paying $10 per dose of the J&J and Pfizer vaccines, he added. The J&J suspension is the latest setback for South Africa's efforts to immunise its population. It ditched plans to kickstart vaccinations with AstraZeneca's vaccine in February. That was after a small trial showed the shot offered minimal protection against mild to moderate illness from the dominant local coronavirus variant. In Johannesburg, there were mixed reactions to the J&J decision.
I don't think it's a good idea because we need it. We need to be vaccinated so we can survive.
It's a good thing, I'll say, because it can save lives.
South Africa's drugs regulator said on Wednesday that it had recently reviewed data from Johnson & Johnson's local research study and found no major safety concerns.